Hi everyone, we will start in a few minutes. Good afternoon, everyone. Welcome back to another informative session with BioBalance. Are you concerned about hypertension, heart failure, or high cholesterol? Then this webinar is definitely for you. For today's session, our wellness expert will talk about how the heart functions, how it gets damaged, and how you can benefit from nutrient testing to optimize your heart health. Our speaker today is a resident consultant at BioBalance and is the first Filipino certified in functional medicine by the Institute of Functional Medicine USA. He is also European double board certified in nutritional medicine and anti-aging medicine. He recently finished his fellowship in integrative medicine in the University of Arizona. Everyone, it is a pleasure to present to you Dr. Stanley Chua.
All right. Thank you, Pat. Thank you for that warm introduction. So today we're going to talk about the heart and specific nutrient imbalances that put the heart at risk. So in the next maybe 30 to 40 minutes, we'll be discussing several aspects of the heart, what it does, how it does it, and what nutrients will be key towards improving overall heart health. So, as you know, with where we are right now in the country, in spite of the ongoing pandemic, we have actually the top killers in the country as mostly coming from diseases of the heart, namely ischemic heart disease or myocardial infarction or heart attacks, other cerebrovascular diseases, meaning strokes and whatnot, and even hypertension. So if you look at the morbidity statistics in the country, a lot of it actually focuses on lifestyle-related diseases. And primarily, these are related to either the heart, sugar issues, or inflammatory problems. So let's talk about the heart a bit. No? So the heart's about the size of your fist and it just weighs about a pound. But in that 1 pound, it pumps blood through more than 60,000 miles of blood vessels. It really tells you the impact of 1 pound in your body. And without the heart, there would be no blood to feed your hands, your brain, your lungs, your kidneys. Without the heart, there would be inadequate oxygen, and life, wouldn't be the same. In a day, the heart needs to beat over 100,000 times each day. That's equivalent to about 36.5 million times in a year. So each beat is actually a contraction of the heart. So imagine that the heart has to beat 24 hours a day, 7 days a week. And you will really get to understand why the heart really plays such an important role in our physiology and our overall health. Now, in spite of it pumping, 24 hours a day and 7 days a week, it actually only consumes over 7% of the calories that we burn every single day. Majority of the calories we burn are actually through our muscles and our brain, and our kidneys and our livers as well. And the heart is only about the fourth or fifth in terms of energy consumption. So in spite of being mostly active and contractile tissue for 24 hours a day, it is actually very, very efficient also in how it utilizes that energy to make its function work. A little known fact is that the heart can actually function separated from the body for up to about 4 hours. So, if you just cut out all the arteries and blood vessels, the heart can still work, even without the brain, even without kidneys connected to it or the lungs connected to it, but only up to about 4 hours, which is the longest it's ever been recorded. Now, in order for the heart to make 100,000 beats a minute, it needs to undergo a process of energy production. And if you go back through your basic biology and basic biochemistry, you'll understand that everything we eat has to be processed and either formed into energy or formed into other substrates that contributes to the body's structure. So when we're talking about the heart in particular, the energy that you get from either sugars, proteins, or fats, in the case of the heart, preferably the fats, it creates a high turnover of what's called ATP. Right? What does that mean? So every time your heart contracts, it utilizes a lot of ATP. And ATP is that substrate that your heart makes or that your cells make in order for muscular contraction to occur or to relax. And so if you look at this picture on the right side, you will see several steps here. You have your fatty acid oxidation, you have glycolysis, Krebs cycle, and even mitochondrial oxidation or fatty acid oxidation. So the heart really utilizes so many mechanisms just so that it can pump 24 hours a day and 7 days a week. Now, what we recognize is that when there is a deficiency of ATP, meaning your heart can no longer produce ATP from the food that you consume, this has been recognized as one of the main hallmarks for what's called cardiac failure or heart failure. Any organ that is deemed a failure basically means it is no longer able to serve the function it was made for. So a healthy cell leads to a healthy heart, which leads to a healthy body or healthy self. And a lot of the dysfunctions that we're seeing now in relation to the heart, from hypertension, heart failure, even cholesterol elevations, is actually due to some form of a mitochondrial dysfunction. And your mitochondria, which is this little green structure here, is actually one of the most important structures inside your cells. And it's responsible for generating almost all of the energy that your body will make in its lifetime. So when this mitochondria is no longer to produce adequate amounts of ATP, your body starts to adapt and change its function. So in the heart, you can see that without much ATP, or there's mitochondrial dysfunction, you have worsening heart failure, lower deteriorating left ventricular systolic function and contractility, so your heart doesn't pump as well. The muscles tire more, you develop some insulin resistance, which is another term for early onset diabetes. And of course, the kidney can sometimes be involved. And so you'll have some renal impairment or renal dysfunction. And sometimes because of that dysfunction in the kidney itself, it leads to hypertension. Now, what's very unique about the mitochondria is that it's a very, very hungry for nutrients. And oftentimes, a lot of the things we do in our lives make our nutrient status worse, or sometimes even the medications that we take can contribute to the lowering of certain nutrients that will contribute to mitochondrial dysfunction. So what are the top risk factors that put your heart at risk for heart disease? So number one, of course, is chronic inflammation. And we'll talk about this a little bit more in depth later. But chronic inflammation basically means that your body is swelling, you know? And any type of chronic inflammation, whether it's from arthritis or from diabetes or from other long-standing diseases, it puts an undue pressure on the heart to actually pump harder. That's why, when we have any inflammatory problem or we have infections, one of the first things that happens is actually that our heart rate increases. Other factors that are related to risk for heart disease are poor calcium metabolism. So this one we see a lot more in women, especially those in the menopausal age group. So calcium that doesn't get into the bone often just stays outside of the bone in the bloodstream and often gets stuck to arteries and other blood vessels, which forms more thickening. Micronutrient deficiencies, which is the main gist of our topic today, is also one of those factors that increase your risk for heart disease. So a lot of us have very, very poor diets, so especially now, given where we are, food choices can become quite limited. Most of us are either just ordering our food all the time, barely even cooking at home. And so, you get predisposed to micronutrient deficiencies. The other reason why you would have micronutrient deficiencies is actually from drug interactions. So when you're taking certain medications, for example, statins, or the generic name would be atorvastatin and other statin-like medications, there is a general agreement that you are going to be most likely depleting your coenzyme Q10 levels. And CoQ10 is actually one of those minerals, one of those antioxidants that actually your body uses inside the mitochondria to pump out a lot of ATP. So imagine that you have medications that reduce your CoQ10 status. And when that happens, you're actually not making heart disease better, but you're making it a little bit worse. So this is where nutrient identification, deficiency identification really matters. Blood sugar imbalances. I think it has to be said that, diabetes and disease don't always go hand in hand. And when you have blood sugar imbalances, the key part here is that, it's not about whether it's always low. It's actually about whether it's always in a stable and steady state. What's dangerous in heart disease and in diabetes is actually the chronic fluctuations in blood sugar. So when you're always going hypoglycemic or hyperglycemic and you're flip-flopping from here to there, that is normally where the trouble starts to arise, And so that's something that needs to be addressed chronically in these people. And the last factor, I think, is stress. And stress is, it can be anything. It can be from work, can be something physical. Let's say, you run 5 marathons every 2 weeks, for example. That can be a very, very strong impetus for stress. It can be mental. Anxiety and depression are quite rampant nowadays. And so a lot of people are having problems struggling. And so that can be a source of a stress on the heart itself. The other factors related to stress are, of course, our work. So a lot of us, have this feeling that, we are quite unstable now at work, or that we are unable to cope with the current situation that we are in, whether it's related to our family or our work finances and whatnot. And so those are putting an unusual burden on the physical and biochemical health of our body. So how does our heart deal with the damage, right? So every time we have inflammation, we have stress, we have blood sugar imbalances, we have nutritional deficiencies, our body responds only one of three ways. No, it's either it increases more inflammation. So imagine that you either have, you're already inflamed, and as a response, your body will want to inflame a bit more. So that's like a double whammy in terms of inflammation. The other response would be, to create an oxidative stress response, which means, it creates free radicals that float in the bloodstream. And so this one is a signal for your body to repair. And the third response is more of an immune response, meaning it calls upon your immune system to activate and begin to heal and begin the healing process. So when you have a heart that's at risk, you need to look at the causes of why you would be deficient, or why would your heart be at risk in the first place. The first is, of course, the diet. Diet has to be up there all the time. And I think it's universal now that a lot of the problems we're encountering from our daily life, and problems we're encountering in our health is actually all related to diets. So, things have changed in the past years. So there's a lot less natural foods. There's a lot more processed foods. There's a lot more fast food. And so there's been different types of revolutions in food, such as farm-to-table concepts, slow food revolutions, things like that, or mindful eating, for example. So diet really plays a big part, because anything you eat either helps your body or makes it worse. So, and you'll notice this in a lot of people, that when they have good diets, they normally do feel a lot better, feel lighter, and feel less inflamed. Whereas those that really get stuck with processed foods and high sugar foods, you often will find them having a very poor lifestyle. They're not exercising. They're often tired all the time. And so diet really has to be said. And when I deal with my patients, it's always, okay, diet first. How do we fix your diet? What are the things that we need to identify in terms of your habits and in terms of what you're doing to help you get better? The second reason for a nutrition deficiency would actually be low stomach acid levels. How does one get this condition? So there are popular drugs in the market called proton pump inhibitors. So these are the omeprazoles, anything with a prazole at the end, or any antacids at that, can cause your body to produce low stomach acid levels. Now, don't get me wrong, these drugs are really useful and actually quite good. But the problem is, a lot of our patients are taking these drugs for very, very long periods of time, sometimes in the months. And I've had patients that have been taking it in the decades. So imagine that all of that acid suppression now is causing very severe low acid levels. And so what happens is that a lot of the nutrients that you get from food will hardly or barely be absorbed, because a lot of those nutrients require the activation through stomach acids in order for them to be adequately absorbed and broken down. So in that regard, if you have been taking some of these medications for a while, the prazoles, you might want to consider checking your nutrient status as well. The third item here is a leaky gut syndrome. So for those that are not familiar with this condition, basically a leaky gut syndrome tells you that the barrier, the barrier inside your intestines that keeps things that are supposed to be outside of the body and lets things that are supposed to be absorbed in the body come in, is broken, right? So now what happens is that the body is no longer able to distinguish between what's supposed to come in, what's supposed to stay out. So things that are supposed to stay out are starting to come into the body. And when you have a condition like leaky gut syndrome, you actually create a milieu where you have more inflammation. You have more inflammation, you have more reactions with food, and sometimes this is a big problem in those with heart conditions. Blood sugar imbalances are also a major cause of deficiency because often, as you understand, as most of you would often understand diabetes to be, it's like it's a high consumption of sugar, right? But what most people are forgetting is that when you have a lot of sugar imbalances, you're also creating the environment where you have what's called insulin resistance. And the term insulin resistance is key because when you have higher insulin, the amount of insulin it takes to reduce a normal load of sugar goes higher. And so your body will keep churning and churning out more insulin, which will make your body get bigger and fatter, and at the same time, make it more inflamed. So those are all, those four are big factors. And, I find are actually quite common in the Filipino population. The fifth item here, are diseases that cause loss or increase in the need of vitamins and minerals. So certain conditions, for example, like irritable bowel syndrome or inflammatory bowel diseases, if you have rheumatism, if you have other comorbidities, or you're taking medications, such as for cancer, chemotherapy, radiation, and whatnot, a lot of those nutrients would become impaired or would become insufficient in the long term. So because our hearts need to beat every day, we need to keep it healthy and strong to handle the body's daily demands. So how do we get our heart stronger? With the proper testing and nutritional support. So who needs to take those tests? Again, let me reiterate, those with multiple medications for chronic diseases, people with persistent medical conditions or symptoms, and those with a highly compromised diet or specialized diet, including vegetarians, including those that are highly restricted diets. No, there are some that really are leaning towards almost very extreme types of dieting where they fast for a month on water, or they there's so many versions of that, right? So what we'll present to you is what's called a cardio nutrient test panel, and basically these are the essential nutrients that we will be testing for in order to look at how is the heart's nutrient requirement, how are the heart's nutrient requirements being met, right? So when you get one of these tests, you'll actually see if you have a deficiency, a normal level, or an excess, because sometimes excesses do become a problem as well. As I mentioned with calcium, excess calcium can be a problem in some women as well. So how do we test for oxidation or antioxidation? Well, we check for things like GGT, right? F2 isoprostanes or oxidized LDL. And then we also have these types of tests, no? So we have your omega-3 fatty acid balance. So, fish oils are becoming very popular, and we'll discuss this a bit more in a while. So when you look at this test, you're looking at several nutrients, the key nutrients for the heart to measure. So again, I must emphasize, the one that really will be the most, so I think I wouldn't say it's superior, but I think it's one of the most important that you would need to test for is actually CoQ10 levels. Aging decreases CoQ10 levels, medications decreases CoQ10 levels, chronic disease will decrease CoQ10 levels. And so when your CoQ10 levels reduce significantly, especially in the heart. The heart's ability or the heart's efficiency to actually do its work will be inadequate. So CoQ10 is that antioxidant that will be key towards making sure that the heart pumps adequately and energetically. You have two types of nutrients here, vitamin B9 and vitamin B12. And why do we really need to check B9 and B12? Isn't B9 or folic acid just for pregnant women and B12 is just for nerves, right? So one thing that most people don't understand about nutrients is that they're not single faceted antioxidants. They're not all just antioxidants. They're actually all also cofactors, meaning they allow for enzyme processes to happen in order for your body to function better. And so one of the things that vitamin B9 and B12 do is that break down something called homocysteine. And homocysteine is a test that you can actually get from any lab. And I often routinely will check this in my hypertensive or cardiac patients because I would like to see if those homocysteine markers are elevated. And homocysteine basically tells you if there's damage in the inner walls of arteries, right? And so if there's damage in the inner walls of arteries, it tells you, okay, that's telling. That's an increased risk already for new plaque to form because that has to heal, that has to scar over, right? And it also tells you that when your homocysteine is higher, it means that it's not just in one segment of the arteries. Remember, you have 60,000 miles of blood vessels floating all around inside your body. And so when you have higher homocysteine than usual, you're not thinking, okay, there's one small space where there's damage. It's actually like the whole system is actually affected just because of a higher homocysteine level. So it's really very key to check homocysteine and put that into context with regards to the heart health. Vitamin D, a very, very well-known and popular nutrient, a pro-hormone at that as well. And optimal levels of vitamin D do reduce inflammation significantly. They also improve insulin sensitivity, which helps improve blood sugar and sugar tolerance. There's a risk though with vitamin D, although I haven't seen it in my practice, even with very, very high doses. But you have to be able to monitor vitamin D and calcium levels properly because vitamin D increases calcium absorption in the intestines. And so when you have a lot of vitamin D, serum calcium can rise, and that one can actually lead to increased blood pressure as well. So we want to be able to strike a balance. My philosophy here would be, it's not that you have to give a lot all the time. It's that you have to give the right amount all the time. So some other minerals that we need to measure for the heart include magnesium. So magnesium is a fantastic molecule. It's a very, very, the best way that I can explain magnesium is that it's a relaxing molecule. So it relaxes you, it relaxes your muscles. It also relaxes your arteries, right? And so in that regard, it helps actually relax the heart as well. So you lower your risk of dysrhythmias in these people that you give magnesium to. You also generally lower cholesterol. And at the same time, angina or chest pain, where there's a tightening of some certain types of arteries in the heart, can be reduced with the help of magnesium. So the likelihood of spastic angina will be less. So excessive magnesium levels, of course, can cause irregular heartbeats. So there is a very, very fine balance between magnesium, calcium, and other minerals in the body. And so, you cannot just give a person, let's say 2 grams of magnesium every day and not expect some side effects to happen. So it's always prudent that you talk to your healthcare provider, especially when it comes to supplements, because they're not all 100% safe. So calcium is key. So calcium works both ways. It is involved in the contraction and relaxation of the heart. It helps maintain your good cholesterol as well. And then when you have too much calcium, there is increased risk of heart disease. And again, I would like to reiterate this, and this is often the practice of a lot of people, is that when they take calcium, they just take calcium with vitamin D. I often will say, okay, when you take calcium, just take calcium with vitamin D and vitamin K, K2 to be exact. Now, the reason why you want to do that is because vitamin K2 forces the calcium into the bones rather than letting them stick to the arteries. Because when calcium begins to stick into the arteries, that's when it starts to create new plaque and harden those tissues even more. So we don't want a lot of calcium floating in the blood. We want the right amount. But when there's too much, we need to give you something like vitamin K, so that those types of calcium ions will start getting rushed into the bones and make the bones stronger instead of making the arteries stronger. Okay. Of course, sodium. So sodium plays significant role in regulating blood pressure. So that's why for someone who has really high blood pressure, we often say, okay, no salt diet, right? Or a very, very low salt diet. So sodium plays a very, very major role in that. So whether you have too much salt, too little salt matters. And so this is a very key process. Zinc is quite popular now because of where we are. And at the same time, it's also a potent antioxidant to help neutralize free radicals. No? So zinc is one of those things that it's great for the immune response. It's great for the healing response. But there are many different types of zinc, and we'll talk about what do you use for what, and where, and see how that can help you guys get a healthier heart. We also look at what's called ferritin. So ferritin is a carrier molecule of iron, and it's an indirect marker for inflammation. So when you have very, very low carrier molecules of iron, you can contribute to more coronary artery disease or heart failure even. No? So iron is essential because it helps it helps with the energy production also in the mitochondria. Now, this is a little known used supplement when it comes to heart disease, and it's called selenium. So selenium is an antioxidant, and it helps fight free radicals. And one of the main roles and why selenium is really important for the heart is because selenium is actually a very, very good glutathione recycler, right? So your glutathione actually just changes from oxidized to reduced forms in a cycle. No? So and when you want to make a lot of glutathione, selenium is actually one of the major cofactors that actually allows you to do that. No, more often than not, you look at selenium, you look at common literature, you'll find okay, it's great for fertility, it's great for prostatic health, but it doesn't say much about the heart. But the selenium actually in itself actually helps with the overall antioxidant capacity of the body. You have lastly here your EFAs, or your essential fatty acids. And basically the EFAs are meant to support the heart by decreasing inflammation, preventing clot formation, and maintaining healthy blood pressure and cholesterol levels. So an ideal omega-3-6 ratio to promote heart health is around 1:1. Okay, so this is ideal, but it's not practical. So right now, if you take a consensus of people from healthy to unhealthy individuals, you would find that more or less the average ratio is around 8:1 to 10:1. That's omega-6. That's omega-6 to omega-3. So there's really a high abundance of omega-6 fatty acids in the world, in the food we eat, and in the products that we consume. And the higher the omega-6 content in the food we have, the higher the likelihood of it causing more inflammatory processes to occur within the heart, whether it's to the arteries or the heart itself. And so having a better balance of omega-3 and omega-6 will actually help improve overall health. So when we go to testing, for example, you can actually see, okay, how much omega-3s you have, how much omega-6s you have. And then we get ratios from those parameters. And what we're looking at is, okay, how close are you to that 1:1 or 4:1, which is more practical. And so we try to push you in that direction of creating a ratio as close to 1:1 as possible. So it's not always possible. Of course, there are many factors why that will not always happen, and diet's always the big barrier there. But we try to get you there through adequate supplementation. So how do we supplement for the heart, right? So if you look at CoQ10, you need approximately at least 50 milligrams to about 600 milligrams of CoQ10 each and every day. So that's a lot, no? So most supplements will come in 100 milligram capsule. Some will be around 50. Very rarely do I see anything more than 200 or even 300. So often if I have a patient with a lot of complications, they're always tired, brain fog, things like that. CoQ10 is one of the first things that I would like to check. Is there enough inside your body? The thing with CoQ10 is that the quality CoQ10 really are quite costly. So they're quite expensive. And so when you want to, take this on a long-term basis, you have to expect that, okay, you're going to spend a little bit more than usual. Okay. Vitamin D is also key. So I had a patient the other day, and they asked me, aren't we in the Philippines? It's always so hot. Why, why are we all vitamin D deficient every time we get tested? And the reason is we're all in the office. It's either we're all in the office, or we're all fully clothed, or we're all in the city, right? And no one likes to be out much in the city. So especially now with the quarantine and the pandemic, the likelihood that we will be out is even less, right? So vitamin D is something that you'll need to check, and once you check that, you'll be able to roughly gauge a dose. So the rule of thumb I have is that for every 1,000 IU, of vitamin D, you raise your vitamin D level by 5 nanograms in 6 months. So for example, I have a vitamin D level of 20. If I wanted to get it to 30 in 6 months, I would need to take about 2,000 IU per day, right? So vitamin B9 and B12, roughly around 400 to 1,000 micrograms per day. So this isn't really a lot, it's just micrograms. And so what we typically look for in certain nutrients like vitamin B9, vitamin B12, is that we try to look for what's called methylated forms, right? So this first two syllables at the start of the word methyl, that's key because it tells you that these are already activated forms of the vitamin. So there is a genetic defect that's it's a worldwide genetic defect affecting about 1 in every 3 to 1 in every 2 individuals in the world, where you cannot activate plain folic acid or plain B12 properly, right? And so what your body fails to do is it fails to turn folic acid into methylfolate. So this is a way to sort of like bypass that step and just really get the nutrients you'll need. So the fifth item here would be magnesium. So magnesium can be dosed so many ways. Of course, the one thing that will stop you from going much higher is diarrhea. So that's the most common side effect with magnesium before you have all the heart complications for an excessive dose. So you will experience diarrhea first. So with magnesium, every person's tolerance is a bit different, and everyone's dose is also a bit different. So I have a patient now, I give him about 600 milligrams each day. Then I have someone who's much older that just needs 100 each day, and they're perfectly fine at that. So it's really finding out through testing what dose you need to give. So with magnesium, there are several forms available in the market, and what I would prefer is that you use something called a chelated type of magnesium. And the same goes for zinc. Find the chelated form of the zinc. Because the reason for your wanting to have a chelated form is because they offer much more broad benefits rather than just the plain magnesium itself. So there are forms like magnesium glycinate, magnesium aspartate, magnesium threonate, and whatnot. And all of those have specific purposes towards what you want to do. You know, if you want to sleep better, you get the glycinate form. If you want to have more energy, get some citrate. If you want to have better bowel movements, get a citrate. If you want something more for the brain, you get a threonate, so etc. etc. So there are so many different forms of this by now. So feel free to look that up. So zinc has an upper limit. So, and I've seen this because of the pandemic. I've seen people actually overdose on zinc. And so, how does that manifest? So, typically, people have a loss of their sense of taste or smell. Ironically, that's a symptom. So they start to feel, oh, it feels a bit metallic, my tongue feels different, or something feels off. So zinc can become toxic if you're taking more than 75 milligrams every single day. So be careful when you're taking zinc, and you have to watch out, because a lot of us are taking multiple immune boosting supplements, and a lot of them would contain zinc amounts ranging from about 10 to about 40. And so if you're taking several kinds or several brands within one day, you might have to be actually very cautious. Okay, so not all zinc is the same. So there's zinc oxide, there's zinc carnosine, there's zinc glycinate, and other chelated forms of magnesium. So zinc carnosine is more used for gastrointestinal upsets, because the carnosine helps soothe the stomach. The zinc oxides and the glycinates, that's the one that you'd often find in the supplements meant for boosting your immune system. Okay. Selenium, roughly you give it around 200 to 600 micrograms per day. Typically, I mostly will give around 200, but it really depends on the glutathione status of my patients. If they're really unable to form a lot of glutathione, I would often support that by giving them selenium. Next is calcium, right? So 500 to 1500 milligrams per day. I would rarely exceed this dose. And I would urge everyone to have caution if they're taking more than 1,000 milligrams a day, because that does promote more kidney dysfunction. You form more stones more readily, and it's not helpful that we are in an environment of high vitamin C intake, right? So everyone's taking like 2 grams of vitamin C, 5 grams of vitamin C, 10 grams of vitamin C. And if you are that type that, you develop kidney stones very easily, you have to lay off the vitamin C, and you can't use a very high dose of calcium as well. So, and lastly is of course fish oil, right? So fish oil is one of the it's a more ubiquitous type of supplement that we can find for heart health. There is a caveat with fish oil. Initially, when you take fish oil, it does increase your cholesterol a little bit, usually around 10 to 15%. But as your body gets accustomed to it, and as you approach that, near 1:1 to 4:1 balance of your omega-6 to omega-3, you're actually getting closer. You're actually going to notice that the cholesterol will start to reverse. So that's something you need to be mindful of. Okay. Now with fish oils, the dosing that you can see in literature varies. It's somewhere from 300 to 3,000. Now I normally only use doses above 2,000 milligrams per day in situations where there is high inflammation. Right? So if I can see, okay, I check inflammatory markers for this person, and I can see that, oh, it's really, really high. That's the time that I will start looking at, okay, can this person utilize something like a 2,000 milligram dose of fish oil? So what's important to look at with fish oils is don't just look at the total amount of fish oil, but rather look at the EPA, DHA content, because that is the therapeutic chemical within fish oils. Okay, so those are the things that I want you guys to sort of like take note when it comes to supplements for the heart. So not all of these supplements you'll need. No, who wants to take how many? 1, 2, 3, 4, 5, 6, 7, 8, 9. who wants to take 9 capsules every single day, twice a day, even for some, right? No one wants to do that, right? So that's why for peace of mind, really don't guess. We really want to encourage everyone to test, to really find out what are they missing, what's lacking in what they're already doing at the current moment. Because in that way, you'll be able to streamline, okay, these are really essential towards me getting better. And these are really things that, are just nice to have, but not really doing so much more. So those are the things I'd like you guys to take home from here. So if you look at what I've discussed, when you're trying to treat the heart, you're trying to treat heart conditions. The current model where, okay, if you have hypertension, I'll give you antihypertensive. If you have high cholesterol, I'll give you anti-cholesterol. If you have an arrhythmia, I'll give you anti-arrhythmic. That model seems to be lacking, because the heart is intrinsically more complex than that. And the heart finds ways to either overcome, or, the heart is often overburdened as well because of, your lifestyle and the way you're living your life. So medications do offer significant benefits in the short to medium term. But in the long term, you'll often find that one medication is no longer enough, and you'll need a second one, or you need a third one, or a fourth one. And it's sad to say that if we have a more complete understanding about how do we really improve the heart nutritionally, how do we improve the heart in terms of its function, in terms of its in terms of the arteries and blood vessels, we can really reverse a lot of the problems our patients are experiencing with regards to heart disease. Reduction of complications, reduction of mortality at that. And especially given the situation we are in now, it's even more imperative, it's even more important for us to take care of our hearts, because that is one of those organs that's really affected by this pandemic. So I thank you everyone for listening this afternoon.
All right. Thank you so much, Dr. Stan, for that enlightening heart-to-heart talk. I hope our viewers are able to recognize the benefits of nutrient testing in keeping a healthy heart. Now, let's move on to the Q&A. I have here a couple of questions from our viewers. Let me start off with the first one. So the first question, one viewer asked, can I reverse hyperlipidemia? I have history of excessive alcohol consumption.
Yeah. So yes, I think yes. So hyperlipidemia can be reversed. So there is such a thing as familial hypercholesterolemia, where it really runs in the family, that everyone has high cholesterol, minus the risk factors like diet and alcohol and whatnot, right? So, but since you have this condition where you actually are taking a lot of alcohol, you do tend to force your liver to push out a lot of cholesterol from the liver. So that's actually the main culprit there in your problems, that if you have a lot of alcohol, the liver just works harder and harder. And the more that your liver has to work harder, the more that the cholesterol has to be produced by the cholesterol to start clearing out the alcohol from the system.
All right. Okay, another question. Once my nutrient deficiencies are corrected, is it possible to taper down my statin medications?
Oftentimes, yes. So my experience here is that if you're able to correct a lot of nutritional lifestyle problems of a person, you're actually able to see significant changes in the cholesterol without actually giving any medications, and just with the support of a handful of nutrients, to be frank. So yes, you can actually reverse or taper down the use of your statin medications.
Okay. Third question, Doc. How does my family history affect my heart health?
Yeah, so like I mentioned earlier, there are conditions that do predispose you to more adverse heart events. No, so one of the things I mentioned earlier was there's familial hypercholesterolemia. So it means there's cholesterol that's rampant, that's high throughout the family. There are, of course, gene defects in the metabolism of your ApoA or ApoB. Those are more technical, but those are subsets of cholesterol that tell you whether you are predisposed to a more atherogenic type of a heart, or are your risk is just normal. So, genetics do play a part towards your risk, but I think it has to be said that genetics, you're born with it, but how you live your life is really up to you, right? And so if you're living your life that will activate those genes, those genes will start to turn on, and you start to manifest with those problems. So it's really that environment to gene interaction that you're looking at.
All right. Another viewer asked, Doc, are birth control pills contribute to heart disease?
So yes, birth control pills do contribute to heart disease because you have a very, very potent estrogen in the pill, right? And that pill actually increases coagulability in the blood. So their blood actually becomes a lot thicker, a lot stickier when you're on a birth control pill. So you actually have to monitor a person very closely on birth control. So it's not just about, do they have menstruation, or, they have regular cycles. It's not about that. It's actually also about, okay, can we see, okay, is your blood getting a little bit too sticky at this point, right? So because of that nature where the blood flow, when blood is very sticky, blood flow is slower. So the heart has to pump harder just to push that volume of blood out. So that's sort of one of the consequences of taking birth control pills.
Okay. Next question. Is it true that a glass of red wine is good for your heart?
Okay. So yes, it's true that a glass of red wine, simply because, well, one thing that's important here is the chemical called resveratrol. So resveratrol is a very good antioxidant that you can find in red wine. And it's really why red wine has been touted to be beneficial for the heart, for its resveratrol content, as well as for the tannins. The other thing about red wine is that it's not true that it's just a glass. So it's 1 to 2 glasses, two to three, was it 3 to 4 times a
Wine.
week for men, and it's one glass for women, 3 to 4 times a
Yes.
week. So that's sort of like the difference. So I don't know if it's something, there's some sexist thing about that or whatnot, but but that's what I read all the time. Okay.
Okay. So this one, Doc. One viewer shared. No, I recently had angioplasty and one stent was placed due to heart attack few months before. Currently, I'm on my medication. Now I have several bruises in my body. Do you suggest I undergo the test, the specialty test?
Okay, so the bruising is not from the heart. It's actually from the medications you're taking, because you have a stent, and so you're most likely taking some type of an anticoagulant, right? What the test can help you identify is that, one is, it will help you identify, okay, how can I prevent my other arteries from clogging up? That's what the test that's what the test can help you with. So if the test can actually show you, okay, this is what you need to do in terms of your diet, in terms of what you need to do in terms of support, then you can begin to prevent future heart attacks. Now the stent is already there, right? So unless there's some compelling reason that it can be taken out, you have to either do one of two things. One is you need to talk to your doctor about switching to a different anticoagulant, or number two is trying to lower down the current dose of the current anticoagulant.
All right. Another viewer asked, I was diagnosed with valvular disease. Is it reversible? And I'm currently 4 meds, mostly blood thinners.
Sorry, was that valvular disease?
Valvular disease. Yes,
Okay.
doc.
So valvular disease is usually because the hearts become too lax. Parang it's sort of like dilated a bit. So the valves are sort of loose. No, that's one type of valve disease. Now there are other types of valve disease, stenosis and whatnot. I don't know which one you have to be exact, so I'm not gonna be able to comment fully if the nutrient test or the test that we do here can actually help in that regard. So, because those are very, very different scenarios.
All right. This is the last question, Doc. No? So, where can I avail the test, and how is it different from the usual lipid profile?
So when you're looking at a lipid profile, it does not necessarily tell you anything about risk. It only tells you about your cholesterol and how much you have of it. But it doesn't tell you, okay, is your heart at risk? Because we do know that even if your cholesterol is very normal, you do often find that there will always be some people, they still suffer those heart attacks, they still suffer strokes, right? So cholesterol is not a fantastic way to tell you, okay, your heart is at risk just because it's high, right? That's the thing about the lipid profile that it doesn't tell you. So how is it different then for this test? So what we're looking at here is we're looking at energetics. We're looking at what allows your heart to work better, and what's missing in that equation that is causing you to have problems. What is it in your body that's causing your heart to continue to be worse or your disease to continue to be poorly managed in spite of multiple medications. So it's really what the test is intended for, um, rather than looking at cholesterol. So this test complete does not really look at cholesterol at all. It looks at what's happening within the cells of the body, um, rather than what's in the blood. So it's just two different things that we're looking at.
Okay. Sorry, Doc, pahabol na question.
Okay.
So, one viewer asked, are there any contraindications between or among the nutrients mentioned and heart medication? Do we need to consult our cardiologist before taking any of the nutrients or the nutraceuticals?
Yes, always. So
Yeah.
my rule of thumb in practice is that I normally don't touch a cardiologist's medications for my patients. What I do for my patients is I make sure that what I give them does not have significant reactions towards the medications they're taking. So, for example, in the example of the anticoagulants, no, so whether you're taking heparin, clopidogrel, aspirin, and whatnot, when you're giving high doses of fish oil or omega-3s, you can actually increase anticoagulation. So you need to expect that, okay, these people will bruise a lot more. And so that can be a big problem in some people. The other thing is with some medications, let's go back just a slide, hold on. So with certain medications, for example, with regards to what do you call this? Certain hypertensive medications, they do react with calcium. So you have to watch out for that. Your doctor will be knowledgeable at that. And of course, your vitamin B9 and B12 can be a bit affected also by certain medications. Whether these nutrients affect the medications, meaning the other way around, often it's just the fish oil that I find that there's always a problem because of that coagulopathy that happens. But regards to the rest, I don't see too much. Oh, there's one more pala, I forgot. So when you have higher doses of magnesium, you can actually induce lower blood pressures. So you may expound the effect or increase the effect of your medications that are meant to lower your blood pressure.
All right. Okay. So that wraps up our Q&A portion. For those who have follow-up questions that who commented in our Facebook comment section, we will answer them right after the webinar. All right. So, as a special treat to our viewers, we're giving an exclusive 10% discount and a free 30-minute consultation for every nutrient test panel availed. Promo is valid until September 30 only. So right after this webinar, be sure to visit our website at www biobalansinstitute.com and use the promo code HEART10. For those who want to avail the nutrient testing or any follow-up questions that you may have, drop us a line through our Facebook or Instagram page. Or you may also contact our hotline number 0917-866-2689. Again, that's 0917-866-2689. As always, thank you everyone for tuning in, and we look forward to seeing you on our next webinar. If you have any particular health topic in mind, do drop us a note on our Facebook and Instagram. Thanks and bye everyone.